Metformin, also known by the trade name Glucophage. Metformin is indicated for the treatment of type 2 diabetes mellitus, as well as for the treatment of polycystic ovary syndrome. Metformin works by decreasing glucose production in the liver, decreasing absorption of glucose, and by increasing cellular insulin sensitivity. The therapeutic classification of metformin is an antidiabetic agent, and the pharmacologic class is a Biguanide. Special considerations for nursing include not using in those with renal dysfunction or patients in metabolic acidosis. Metformin may cause diarrhea, nausea, and vomiting, and in rare cases, lactic acidosis. Patients should be monitored closely for ketoacidosis and lactic acidosis, and metformin should be stopped in any acidotic patient. Metformin has been reported to cause a metallic taste by some patients, and patients should be instructed that this medication only manages but does not cure their diabetes. Metformin does carry a black box warning over the risk of developing lactic acidosis. These significant events have led to deaths as well as other significant deficits in patients. It is important to know early symptoms such as malaise, muscle pains, respiratory depression, or elevated blood lactate levels. Risk factors for the development of lactic acidosis include concomitant use of carbonic anhydrase inhibitors, being over the age of 65, receiving any contrast medium for radiologic studies, having renal dysfunction, being in a hypoxic state, having excessive alcohol intake, or those undergoing surgical procedures.
This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.